Hi, my name is Dr. Gil Lederman. We're making a DVD about prostate cancer to convey information to you in the most vivid way through the art and through words and through data. This does not take the place of a consultation, but it might be a good start to give you an idea of how treatment can change your life for the better or for the worse. And we're here to offer treatment for the better, of course. With years of experience, thousands of men that we've treated with prostate cancer, and our data, which is all so invaluable to you and your family to understand how treatment can make your life better, safer, and avoid the pitfalls of so many other methods of treatment out there that may well be less successful and harmful to your quality of life, like sexual function and urinary function. We're here because we believe most men want to avoid radical surgery, avoid robotic surgery, avoid prolonged courses of radiation, but yet have the highest success rates and maintain sexual function and urinary function whenever possible. This piece of art, and we have many pieces of art, show what we do. And what we do is hit the target. How do we hit the target? Well, number one, we have an experienced team. And number two, our mission is to hit your prostate cancer non-invasively with invisible beams that come from thousands of angles, to avoid radical surgery, to avoid robotic surgery and all the complications with open surgery, and to have better success rate. We have the data to prove it. In some institutions and doctors, communication seems chaotic. It's almost impossible to find the doctor or speak to the doctor or meet with the doctor. Here, it's direct. You have a doctor who's board certified, actually triple board certified, ready to meet and speak with you and your loved ones. Our prostate cancer treatment is focused on you. Not a hospital, not surgery, not a gizmo, but on the patient and getting the best possible results. This is a letter written by the director of robotic surgery at a major cancer program in New York City. This letter was talking about a patient, and we got it in the patient's chart from that other institution. I read it to the patient. The patient never, ever heard all the potential complications that were associated with robotic surgery. This letter explains. It's a real letter. We've changed the name. It's a real letter. We've just changed the names to protect the innocent and their privacy. But it talks about the potential complications of robotic surgery, including infection and positional injury, blood clots in the lung, injury to the bowel and the rectum and the ureter, cardiac damage, which means heart attacks or infections, pneumonia. Penile shortening. The most common cause of penile shortening in America is radical surgery. Radical surgery for prostate cancer causes shortening of the penis. But I've never seen a patient who's been explained that by the surgeon. Also, urethral strictures, incontinence, infertility, and impotence. And then the surgeon concludes, and this is a letter he wrote, and he said he described it to the patient, that there is no convincing study showing superiority of robotic surgery. If they can't find a study to show superiority of robotic surgery, why the heck are they doing it? We know why we're doing what we do, because it is better. Better results, avoiding radical surgery, better quality of life. That's why we're here today. In every room at Radiosurgery New York, 1384 Broadway, you'll see this sign, and it says, "You are the President of the United States of your body." And it means that you have the power to decide. The doctor should work for you. The doctor is not the president. You're the president of your body. We work for you. We provide you all the information and options, and then you, with your logic and common sense, you make the best decision for you. We have a team of physicians, nurses, technicians, physicists, dosimetrists, and staff, all together a team that fights for you. Why are we providing this information? Why do we have a booklet? It's to help you understand all the options available to fight prostate cancer and how certain options are so different than others. What's our secret weapon in the war on prostate cancer? It's logic, it's experience, it's decades fighting prostate cancer with data, and data from thousands of men that we've treated over more than 25 years. How does a doctor prepare to fight your prostate cancer? Went to medical school, MD, triple board certified in medicine, medical oncology, radiation, trained at Harvard, first doctor in America to perform stereotactic body radiosurgery with decades of experience. We believe men want to know the facts before they make a decision. If you don't know the data, most likely you'll get a result that you really didn't expect, didn't know about, and will be shocked. We believe a man with prostate cancer should learn the data, get the best results, avoid radical surgery, avoid robotic surgery, avoid open surgery. We believe most men want to maintain their sexual and urinary life. We believe most men benefit by coming here for consultation. You can love yourself, or you can love your surgeon. Sometimes it's hard to love both yourself and your surgeon. That's why we suggest looking at the data first. We are not sorry to be America's radiosurgery pioneer, and we're not sorry for all the surgery that's no longer needed. This shows results of our data based on initial PSA versus the most famous surgeon in New York. And you can see that in every category, our results are better than the most famous surgeon in New York performing radical or robotic surgery, from 18 to 66% better, with more than 200,000 men a year diagnosed with prostate cancer. If every man came here rather than had surgery in the most famous hands, you'd be talking about tens of thousands more men cancer-free from prostate cancer each year, and with better quality of life. Untreated prostate cancer grows. Most men that we treat with prostate cancer are in remission. What do you prefer? We believe most men would rather be cancer-free. Doesn't that make the most sense? Some people try to beat our prostate cancer data and results with gadgets. Don't get confused by the gadgets. Look at the data, see the actual data. That's why so many men with prostate cancer come to us. The differences of prostate cancer treatment are very, very big. That's why it's so important to get the data first, to get the best results, best quality of life, avoid radical and robotic surgery, and prolonged courses of unnecessary treatment. Not all treatments that try to copy us are equal. This is the data from a famous hospital in New York that's trying to copy us. And if you look on paper, their techniques are similar, but they don't use a radiosurgery frame, they don't have our expertise, they don't have our years of data, and you can see that our results are up to 28% better. We know that every man wants to get the best possible results. If you can come here, have your own doctor, have boutique medicine at a lower cost, and have 28% better results, doesn't it make sense to come to 1384 Broadway? This illustrates differences between chemotherapy, standard radiation, and the revolutionary radiosurgery that we brought to America and to the Western Hemisphere. Chemotherapy goes most commonly everywhere from head to toe. Sometimes it works early on, sometimes not, but after a while, most commonly the cancer resists the chemo. That means the cancer mutates, the cancer changes, and becomes resistant to the effects of chemo. So, in fact, the chemo teaches the cancer to become more aggressive. Very commonly, the chemotherapy is toxic from head to toe. Why? Because it goes from head to toe. The toxicity is also frequently lifelong. Chemotherapy not working or not tolerated are reasons to stop the chemo. Ending chemotherapy doesn't mean ending your life. There's many reasons we brought radiosurgery to America. This is one, because there are so many people who don't want chemotherapy, can't have chemotherapy, or chemotherapy just doesn't work. If you compare us to standard radiation usually gives weeks and weeks of low doses of radiation, and there's lots of collateral damage or collateral radiation to the healthy surrounding tissues. Usually radiation is given not only to the cancer area, trying to find it, but to the area of the normal healthy body to the right, to the left, below, above, in front, and behind. Because of this, standard radiation frequently doesn't work or has side effects that many people do not wish to have. That's another reason we first brought stereotactic body radiosurgery to you. In distinction to both chemotherapy and standard radiation, radiosurgery is directed at the cancer without that collateral damage in general to the healthy tissue. Also, we give a few doses that are very intense and very effective directly to the cancer. This is what most people want when they come to us. They don't want the chemo all over the body. They don't want standard radiation going and hurting healthy tissues. They don't want weeks and weeks of treatment when you can have more focused, more intense treatment. That's the work that we do here at Radiosurgery New York. High dose per treatment, custom-made treatment for each cancer, most commonly successfully performed where we attack the cancer. This shows how the radiation seed dose distribution occurs in the prostate. It allows us to focus in on the area where the cancer is, give the highest dose to the prostate cancer, and avoid prolonged courses of unnecessary treatment. This shows our stereotactic frame. It's custom fit for each patient. It's painless, non-invasive, but it's a very accurate way of focusing the beam from thousands of angles on the prostate cancer. All non-invasively, all as outpatient, with an average treatment taking about 10 minutes. This shows how we computerize the patient's body. We find the prostate cancer in relationship to the body and the stereotactic frame, and then send invisible beams to attack the cancer. This shows radiation seeds in the prostate directed personally by me, Dr. Lederman, to attack your cancer in minutes. This illustration shows how beams come from thousands of angles, invisible, painless beams, to attack your prostate cancer. Painlessly, easy, 10 minutes, you get up, go to work, go to lunch, or do what you want, not be stuck in a hospital convalescing from radical surgery. Congratulations to our patient who came to us with prostate cancer. He finished treatment for his prostate cancer. Within days of finishing, he traveled to Australia and he ran in world championship races and won the gold, all within weeks of our treatment. What does it tell you? It tells you that, number one, our treatment very commonly is successful for prostate cancer. Number two, our treatment is well tolerated. And number three, most men keep their normal activities during and after our treatment. Dr. Lederman's radiosurgery. What is it? It's precise, invisible beams that hit the cancer. Big boys spend millions of dollars in fantasy advertising to try to create a image, false image maybe. Guess they need to. We offer to treat you as we would want to be treated ourselves. That's a world of difference. That's our tradition. Why do we say Dr. Lederman's concoction-free cancer treatment? because so many people are misled by concoctions that have no chance or in fact can even be dangerous to your health. Try to get the data, try to get the facts, try to avoid things that can harm you or make you delay effective treatment like radiosurgery. Radiosurgery is highly effective, proven over years, well tolerated, and has a long track record. This graph looks at the data from us, Lederman, versus a most famous doctor in Baltimore, and in every category, based upon initial PSA prior to treatment, in every category, our results are superior, from 10 to 28% better than radical surgery by the most famous surgeon in America. And this shows the data for surgery for Gleason 7 cancer. One of the most famous surgeons in America who operates on Gleason 7 cancer at 10 years has only a 46% success rate. That means the majority of men operated on by such a famous surgeon actually have recurrence of the cancer. And we know that a man who has prostate cancer doesn't want to have treatment to then have recurrence. And look at the data for Gleason 8, 9, 10. At 10 years, only 23% of the men are cancer-free by this prominent surgeon. We know we can do better, we know our results are better, and with a better quality of life, avoiding radical surgery. This chart shows the results of radical surgery based on initial PSA. If a man has a PSA 10 to 20, the chance of surgery being successful at 10 years is only 30%, which means 70% of the men have recurrence of their cancer after radical or robotic surgery. Who wants that? A 70% failure rate for PSA 10 to 20? That's another reason why so many men come to radiosurgery in New York. And the same is true for men with PSA more than 20. The vast majority of the cancers come back after radical or robotic surgery by a very prominent surgeon. This is a graph that shows results by the most famous surgeon in New York, and you can see in every category, based upon PSA, our results are from 18 to 66% better. Men do better by coming here, avoid radical surgery, avoid robotic surgery, and have a higher chance of maintaining quality of life and life itself. This shows a man getting prostate seeds in our own operating room here at 1384 Broadway. Yes, all our work is here in Manhattan, where we accept most insurances, Medicare, Medicaid. These hands have placed 500,000 radiation seeds into cancerous prostates. These hands are experienced. These hands can be the hands that treat you, if you wish. This is a graph that looks at 9 weeks of radiation at a most famous hospital versus our radiation prostate cancer results. And you can see with us, the results are 9 to 91% better in half the time at less the cost. Isn't that what you want? Better results in less time at a lower cost with great experience? Isn't that the best option for you? Life's beautiful. Some men have chosen not to have any treatment for their prostate cancer. Perhaps they don't want treatment when they know how difficult surgery is, but perhaps it's time to learn about non-surgical options for prostate cancer. Let's fight to get healthy. Let's fight to get rid of that prostate cancer in a good way. Some men come with questions about proton beam. Proton beam is a different particle. It's been heavily advertised and promoted, especially by banks that buy these machines. Well, you can see at the longest running commercial proton beam center in America, their results compared to our results in the same categories. And in every category, our results are superior than proton beam. Treatment takes less time, it's less expensive, and you have a better chance to be cancer-free. See Dr. Lederman before. Sounds like a very good idea. This shows how prostate radiation seeds are placed. We avoid the urethra to minimize side effects. Many men ask, what are the side effects of prostate seed implantation? Most men feel nothing, and we place the seeds to maximize your comfort and success. This is an X-ray picture showing the prostate seeds in the prostate after implantation. Yes, you may have something to lose by coming here, most likely losing the treated cancer. That's a good thing. This graph illustrates how our treatment is more complex and more desirable than just 9 weeks of external beam treatment. External beam treatment, 9 weeks every day, is prolonged, it's expensive, it's difficult. Here you can come in less time, get better results at a lower cost. We're located in the heart of what used to be known as New York City's Fashion District at 1384 Broadway and 38th Street. We like to think of it as the Radiosurgery District now. Wouldn't the world be a more beautiful place if everything was custom tailored like our stereotactic prostate cancer treatment? This shows results of treatment for Gleason 7 or PSA 10 to 20 prostate cancer. It's comparing our data on the top versus 2 famous hospitals, one in Boston, one in Philadelphia, and their results. You can see our results are about 50% better, which explains why so many men wish to come for treatment here. And for Gleason 8, 9, 10, or PSA more than 20, you can see our results are nearly double those famous hospitals in Boston or Philadelphia. Better results, avoiding radical surgery, that's the issue. And here you can see for Gleason 8, 9, 10, more than 100% better results. That's 200% overall with our program for Gleason 8, 9, 10 cancer treatment versus those same 2 hospitals in Boston, Philadelphia. Better results at the same time point for the same risk factor. Good advice might be get the best treatment and carry on with your life. This is a study from Boston that looks at quality of life of open prostate surgery versus robotic surgery, and you can see that neither one is very desirable. With open surgery, which means the surgeon's hands are in your abdomen, 97% of men have sexual problems after open surgery. Robotic, which they advertise as being better, actually is worse. 97.7% of men have sexual problems after robotic surgery. And urinary problems, which means controlling the urine, which means something we all want. We don't want to walk around wet. Well, urinary problems after surgery occur in 80% with open surgery and 86.8% with robotic surgery. Again, robotic surgery failing to live up to its advertised possibilities. To get a fresh second opinion, you might want to get a fresh doctor on your team. Many men ask, how do I know I'm successfully treated? Well, this is a graph of a patient that we treated almost 16 years ago. He had a PSA 7, Gleason 6, and you can see his PSA after our treatment went down to 0, and for a decade and a half is still at 0, cancer-free, with good quality of life. This is an example of a man with a PSA 4.1, Gleason 7, so he's intermediate risk, almost 19 years after treatment, cancer-free, the PSA 0, doing great with a good life. Here's a man with PSA 14, Gleason 6, cancer, nearly 25 years after treatment, cancer-free. I think this represents what every man wants, and this is the kind of work that we do here at Radiosurgery New York with the data to back up what we say. Here's a man with very high-risk cancer, PSA 28, Gleason 9, more than a decade after treatment, in remission, PSA 0, doing great. This gentleman had a PSA 39, Gleason 7 cancer, more than a decade and a half after treatment, cancer-free, doing well. With this high risk, other treatments most likely would fail. If you're thinking about robotic surgery, remember that 97% of men with robotic surgery have sexual problems, 80% have urinary problems. We believe knowing the data can help you determine the best results. The odds are with you here with Dr. Lederman. Our team of radiosurgery works for you. Our team is able and available and devoted and educated, experienced, motivated, responsible, and responsive, understanding for you. It's best to compare our data, our experience, and our team with any other in New York, in America, and beyond. We always suggest avoiding treatments that don't work, to be suspicious of unproven remedies. We always suggest to stick with a winner. Think about prostate surgery versus us. With surgery, you'll have to go to the hospital with your suitcase and your toothbrush and your slippers, and you'll probably eventually, maybe a week later, after a hospital stay and surgery, go home with your surgical supplies. With Dr. Lederman and our treatment, you can have a Metro card. Take the subway to our treatment. Treatment lasts 10 minutes, and take the Metro home. Take the subway home. Many of our men work and make love the same day as their prostate cancer treatment. That should tell you a lot about our work. Today, I saw my patient, a 90-year-old man whose prostate cancer I treated more than 20 years ago. His PSA has been 0 for 2 decades. He's in complete remission, fully functional. We call it another bullseye. We like to hit the bullseye. That's what we do every day here at Radiosurgery New York. Why are we on the radio every day of every week? Just like this video, we're here for one reason: to educate. Prostate cancer treatment should destroy your cancer, not your quality of life. There's many benefits of our prostate cancer treatment. It's outpatient, no cutting, highly targeted, high control rates, high quality of life, avoiding radical and robotic surgery, avoiding hospitalization, with decades of experience, and most commonly at much less cost. There's many reasons why men prefer our prostate cancer treatment. Some cancer centers demand that their doctors treat a certain percent of the patients that walk in the door, or else they get rid of the doctor. Well, we demand certain things too at Radiosurgery New York. We demand certain things of our doctors. We demand that we always do the right thing. It's our gold standard. Doing the right thing every day at Radiosurgery New York makes us tranquil, makes us a tranquility base. They say they can copy Dr. Lederman. He's triple board certified. He trained at Harvard Medical School. He brought body radiosurgery to the Western Hemisphere when every doctor, every facility, every hospital thought standard treatment was okay. He brought brain radiosurgery to New York when every hospital, every facility, every doctor thought standard treatment was okay. We don't want okay treatment. We want precise treatment that attacks the cancer, that attacks the brain tumor. Dr. Lederman has decades of experience with radiosurgery. They'll need to wake up early in the morning, every morning, and work late, starting 60 years ago, to keep up with Dr. Lederman. Not so easy. It's said that one can see the Great Wall of China from space. Perhaps so, but our thousands of radiosurgery beams that attack your cancer are always invisible. Hope this information has been useful to you. Obviously, it's only an introduction to the work that we do. For your exact questions and needs, it's best to meet in person. You can call our office at 212-CHOICES. Our number is 212-CHOICES because we believe you truly have choices, and those choices can make a world of difference as far as the likelihood of successful prostate cancer treatment and quality of life, meaning sexual and urinary function. So give us a call if you wish, and I wish you all the best. Thank you and God bless you. Bye now.